So let's start with the radiology stations. So one thing, whenever you get a station of on which there is a X-ray or a CT scan, you should know that it's not a radiology examination. It's a pediatric examination. So you need not to give the details which a radiologist should be giving in his or her examination. And this thing even the examiners know. So you should be focusing on the main findings. Dr. Saeed, kindly, if you mute your mic. So you need to focus on the main findings and then look for the minor unexpected finding. So even if you miss the minor findings, still you can score good marks in that station. And similarly, as I already said, that if you do not describe all the details in a radiology station, there are still chances that you may pass or score some points in that station. And in talks, it is the overall passing marks on which you will be judged. So you need not to pass each and every station in the talks examination. So you must have done your previous sessions or even in final year that while describing certain x-rays, you need to be knowing about this is an x-ray chest, PA view or AP view. So I expect all of you that you know what is an AP view and what is a PA view. So similarly, if the child is an adolescent child, so you can even figure out whether it is a male or a female child. Then the full or inadequate inspiration with adequate or inadequate exposure and proper or improper alignment. So I hope that I do not need to explain what is an inadequate exposure and what is a proper and improper alignment. I think these things are already clear to you people. Is it so, Dr. Aisha? जी जी. So anyone who can comment on this X-ray? Am I audible to all of you?
Yes, sir.
Yes, sir.
Okay, so anyone who can comment on this chest X-ray, please.
Sir, this is the chest X-ray, PA view showing mediastinal widening with the bilateral infiltrates in both lung fields, and costophrenic angles are normal, and
जी डॉक्टर फातिमा डॉक्टर यहाँ पे आपको कहाँ नजर आ रही है? So this is Dr. Saab, normal chest X-ray. Yes, mediastinum is slightly wide because here is the sail sign of the thymus. So the mediastinum seems wide because there is a. So if you look here, this is a normal chest X-ray with normal lung fields. If you look here at the bony markings, they are also normal. If you look at the cardiac shadow, if you look at the posteriorly to the cardiac shadow, it's normal. If you look here at the diaphragm, they're all normal. So there is only mediastinal widening, and that is because of the thymus. And if you look here, there is a sail sign of the thymus.
sir,
Agree?
does the thymus shadow goes that down way? Sir,
Yes. Yes,
okay.
Dr. Saab.
Okay.
Thymus.
Okay.
Thymus can go anywhere. Even Dr. Saab, you will find X-rays in which you will find that the thymus is over here. Sometimes you can find even the thymic over here. That depends on the position of the child. So with position of the child, the thymic shadow can go anywhere.
Okay, sir.
Okay, Dr. Saab? So yes, it
Okay,
can
sir.
go here. So
Okay.
okay. So read the scenario. This is chest X-ray of a 4-year-old boy who was admitted to ward with complaints of breathing for last 3 days. On examination, there is decreased air entry on right side.
Um, mm,
Okay, I'll go to the next question. What is the diagnosis, Doctor? So, in exam, you will get this scenario. What are the findings in this chest X-ray? This will have 2 or 3 marks. So, even if you cannot properly describe these findings, if you know the answer, so when you go to the next question, you answer that question rightly, you will get marks. And similarly, if you go through the third question and the fourth question, so still don't worry that you are not knowing the findings and you have done the G. G docs. So what is the diagnosis?
sir, it is pleural effusion, sir, because
So which sided pleural effusion, madam?
right-sided pleural effusion.
Yes, very right. So right-sided pleural effusion. And what can be the likely causes?
It could be sir, it could be tuberculosis. It could be
Yes. So let me tell you that this was one of the stations. This was one of the talk stations in one of the CPSP examination. So the slides which we will be showing you, majority of them will be actual exam scenarios. So mind it that these are already there in exam. So, and the key is also there. So yes, madam, right-sided pleural effusion, and in causes you said that it can be tuberculosis. Second, it can be pneumonia as well, na? Parapneumonic effusion. And now, how will you further investigate this patient? What other investigations would you like to do to confirm your diagnosis?
sir, I would like to do sir, I would like to do ये pleural tap करके to confirm the diagnosis. It's CS and RE. Plus, I would like to do CBC and blood cultures.
Okay. Okay. So let's go to the key. So this is an X-ray chest showing a large homogeneous opacity in the right lower lobe with blunting of the right cardiophrenic and costophrenic angles with a positive meniscus sign. However, there is no shifting of the mediastinum to the opposite side. What is the diagnosis? Right-sided pleural effusion. What can be the causes? So parapneumonic effusion and tuberculosis. So what other investigations would you